per exam questions and answers with explanations for the essential questions. Question 1. A nurse is caring for a patient from a different culture. What is the first step in providing culturally competent care? Ask the family to leave the room. Perform a self-assessment of one's own cultural biases. Assign a translator immediately. Research the patient's religion. Self-awareness is the foundation of cultural competence. Question 2. Which of the following is a primary responsibility of a practical nurse, PN? Diagnosing medical conditions, prescribing medications, implementing the nursing care plan and monitoring outcomes, performing major surgery. PNs focus on care implementation and monitoring within their scope. Question 3. What is the most effective way to prevent the spread of healthcare-associated infections? Wearing double gloves, proper hand hygiene, keeping windows open, restricting all visitors. Hand hygiene is the gold standard for infection control. Question 4. A patient is receiving oxygen at 2L/min via nasal cannula. Which safety precaution is essential? Keep the patient NPO. Ensure no smoking signs are posted. Perform ABGs every hour. Limit fluid intake. Oxygen supports combustion, making fire safety critical. Question 5. In which position should a patient be placed to prevent aspiration during tube feeding? Supine, prone, semifowlers, 30 to 45 degrees, Trendelenburg. Elevating the head of the bed reduces the risk of gastric contents entering the lungs. Question 6. A nurse finds a patient on the floor. After assessing the patient and notifying the doctor, what should the nurse do? Call the patient's lawyer. Write a summary in the local newspaper. Complete an incident/occurrence report. Ignore it if there are no injuries. Incident reports are required for risk management and quality improvement. Question 7. Which document outlines the ethical obligations of a nurse in Canada? The Criminal Code, the Code of Ethics for Registered Nurses, CNA, the Nurse's Personal Journal, the Hospital Employee Handbook. The CNA Code of Ethics provides the framework for ethical nursing practice. Question 8. Informed consent means the patient agrees to everything the doctor says, signs a paper without reading it, understands the risks, benefits, and alternatives of a procedure, is forced to have surgery. Consent must be voluntary and based on full understanding. Question 9. What is the priority assessment for a patient who just returned from surgery? Bowel sounds, airway, breathing, and circulation, ABCs, urinary output, ability to walk. Post-op priority is always physiological stability, ABCs. Question 10. Which of the following is a sign of dehydration in an elderly patient? Increased skin turgor, confusion and dry mucous membranes, slow heart rate, high blood pressure. Elderly patients often show confusion and dry mouth as early signs of fluid deficit. Question 11. A nurse is asked to perform a task outside their scope of practice. What should the nurse do? Do it anyway to be helpful. Refuse the task and explain it is outside their scope. Ask a student to do it. Wait until the end of the shift. Nurses must practice within their legal scope to ensure patient safety. Question 12. When documenting, which entry is most objective? Patient was angry today. Patient yelled "Leave me alone" and threw a pillow. Patient felt sad. Patient had a bad attitude. Objective documentation describes observable behaviors and quotes rather than interpretations. Question 13. What is the purpose of the nursing process? To make the doctor's job easier. To provide a systematic, organized method for providing care. To reduce the number of staff needed. To increase hospital revenue. ADPI, assessment, diagnosis, planning, implementation, evaluation, is the framework for care. Question 14. A patient's blood pressure is 180/110 mmHg. This is best described as hypotension, normotension, hypertension, bradycardia. Hypertension is high blood pressure. Question 15. Which of the following is a subjective piece of data? Heart rate of 80 bpm. Patient reporting, I have a headache. Oxygen saturation of 98%. A red rash on the arm. Subjective data is what the patient says. Objective data is what the nurse observes/measures. Question 16. Beneficence in nursing ethics refers to the duty to do good, the duty to do no harm, the duty to tell the truth, the duty to keep promises. Beneficence means acting in the best interest of the patient. Question 17. What is the correct way to correct an error in a paper-based medical record? Use whiteout. Scribble it out completely. Draw a single line through it. Write error and initial. Discard the page. Integrity of the record must be maintained by showing the original entry and the correction. Question 18. A patient is choking and cannot speak or breathe. What should the nurse do? Call for a tray of food. Perform abdominal thrusts, Heimlich maneuver. Give the patient a glass of water. Ask the patient to lie down. Abdominal thrusts are the intervention for a complete airway obstruction. Question 19. Which of the following is an example of negligence? Administering the wrong dose of medication. Answering a call light promptly. Checking a patient's ID band. Washing hands before a procedure. Negligence is the failure to provide the standard of care, leading to harm. Question 20. What should the nurse do first when a patient complains of chest pain? Give a glass of water. Assess the pain and check vital signs. Call the patient's family. Wait 30 minutes to see if it goes away. Chest pain requires immediate assessment for potential cardiac issues.